Thank you so much for that very kind introduction, Stacy, and to Population Connection for having me. I am so glad to be with you all. First, let me just take a moment to thank all of the activists in the audience today for your dedication to this very important cause. Your support means so much to so many, and we are all deeply grateful for your work. Now, in my time in Congress, I have seen firsthand how the global gag rule deprives people, especially in the world's lowest income countries, of desperately needed medical care. 3 years ago, we had a dangerous anti-abortion administration that not only reinstated the gag rule, but radically expanded it. This threatened global health and undermined local efforts to save lives and expand reproductive rights. Doctors should be able to talk freely with their patients about all of their options, not just what the anti-choice politicians thousands of miles away deem acceptable. And yes, I'm very proud of the fact that the Biden administration, they took immediate action to once again repeal the gag rule last year. But Congress must make the repeal permanent so that no future president can bring it back. No matter where people live, they deserve access to comprehensive reproductive care, including safe and affordable abortions. As co-chair of the Pro-Choice Caucus and chair of the Appropriations Subcommittee on State and Foreign Operations of the Appropriations Committee, I'll keep fighting against this dangerous, cruel policy. And yes, I intend to continue to fight with my colleagues to pass my bill, the Global HER Act, which would permanently repeal the global gag rule. Your dedication and activism will be the force that helps us get this bill across the finish line. Thank you again for your support and keep up the good work.
So we appreciate the kind words from Representative Lee. I'm going to introduce our panelists tonight now. They are Caitlin Horrigan, who is the Director of Global Advocacy at Planned Parenthood Federation of America. With over a decade of foreign policy experience, Caitlin drives PPFA's global advocacy agenda with Congress and the administration to protect and expand funding and policies that advance sexual and reproductive health and rights worldwide. She's the co-chair of the International Family Planning Coalition and has led successful efforts to expand abortion access for Peace Corps volunteers and build unprecedented opposition to the global gag rule. She previously worked as a senior legislative policy analyst at PAI, where she focused on international family planning, reproductive health, and HIV/AIDS funding and policy issues. Prior to that, Caitlin tracked state policy at PPFA and investigated potential First Amendment violations with Americans United for Separation of Church and State. Originally from Amherst, Massachusetts, she graduated from Vassar College, where she majored in political science. So thank you, Caitlin, for being with us. And also tonight, we have Associate Dean for Research and Partnerships and Professor of Law, Dara E. Purvis from Penn State University, sorry. She's a scholar of family law, feminist legal theory, masculinities and sexuality, gender identity, and the law. Her work examines gendered impacts of the law and proposes neutralizing reforms, most recently in the context of how the law defines parenthood. She has been published in, among others, the California Law Review, Wake Forest Law Review, Florida State Law Review, Michigan State Law Review, Case Western Law Review, the Yale Journal of Law and Feminism, Cambridge University Press, and the New York Times. Prior to joining Penn State Law, Professor Purvis was a visiting assistant professor at the University of Illinois College of Law and a visiting fellow at the University of Kent Research Center for Law, Gender, and Sexuality. Former editor-in-chief of the Yale Law Journal, she clerked for the Honorable Gerard E. Lynch, U.S. Court of Appeals for the Second Circuit, the Honorable Raymond C. Fisher, the U.S. Court of Appeals for the Ninth Circuit. And in addition to all of that, Dara is a board member of Population Connection. So we're so pleased to have both of these experts here tonight to talk about the landscape for reproductive health and rights, both domestically and internationally. So the first thing, ladies, that I just wanted to welcome you and say thanks so much for being here tonight and just give you a second, how are you doing? It's been a rough few years, and then we had a couple of pandemic years, and now we're coasting into year 3 of the pandemic. And it's been a tough time. Hope everybody's taking care of themselves and holding up well and finding some ways to be joyous. So first, I just wanted to ask you both, I think Caitlin first, let's talk about the international picture. Let's talk about what's going on currently. What's the landscape look like? Where have we been over the last few years and where are we now?
Thanks, Stacy, and just a big thank you to Population Connection and all the Fight for Her advocates on the line. You've been such key partners and voices, I think, to envision a world and really deliver a world with sexual and reproductive health and rights for all. So on behalf of Planned Parenthood and just all of us in this fight together for permanent gag repeal and so many other critical necessary change, just appreciate your energy and partnership. I think, Barbara Lee laid it out well. And Stacy, you echoed, we have come off a really hard 4 years of relentless assaults on our issues, on our bodies, on our rights, on our decisions, on our families, name the thing. They were under attack. But of course, we are coming off a reality where it wasn't that good even before. There were a lot of inequalities, a lot of unfinished business. So I think a lot of us doing this work in the last year, of course, have been buoyed by the hope that, more supportive policymakers offer, but also with a really clear eye that returning to the status quo of where we were, circa 2016 was also not good enough. So I think we've made a lot of headway in the last year to sort of reset the floor, but there's still a lot of work to do to really move beyond that point, So yes, there's stuff to celebrate, rescinding the Global Gag Rule a year ago, restoring funding to UNFPA, the lead agency delivering reproductive and maternal health care around the world, many other things to, hold on to, and I think give us some strength about what we are making progress, but there's still a tremendous amount of work to be done. And I know this month, with the funding bill sort of failing to deliver on some key agenda items, I'm still feeling the frustration and rage of I believe in incremental change, but we got to see those increments. And I'm impatient because we've been at this for so long. So, there's a healthy mix in feeling like we are accomplishing things, but still wanting more and wanting to push for that next phase of the work. So just to say, grateful to have all of you in partnership to try to get it done, and happy to be in conversation with Stacy and Dara too.
All right, so Dara, tell us about what's going on domestically. There's been a lot just in the last 6 months, and that's after a decade of
yes,
constantly increasing state level attacks on reproductive rights and abortion access.
Yes. So I will also start with a footnote to my bio that I should really put this in my faculty bio page. I left out from my previous positions was intern at Population Connection, which I did right after I graduated college. I was an intern there for several months before I went off to grad school. So Population Connection is very near and dear to my heart. And, I've been familiar with the great work that we do for a very long time, which is great. So yes, quite a bit has been going on. There in the last 10 years has been a real spike in regulations of abortion access and healthcare in the United States. But the last couple of years, obviously the Trump administration, ushered in a real support for anti-abortion advocates. And in the last couple of years, there are a couple kind of landmark things going on. So the one that is at the forefront of my mind, certainly as a law professor and someone who teaches and works in this area, is that there is a case currently before the Supreme Court that was argued back in December, assessing the constitutionality of a 15-week abortion ban in Mississippi that was passed very explicitly saying, we know this is unconstitutional under current understandings of the right to privacy under Roe v. Wade, and we're going to pass it anyway because we want to give the Supreme Court with 3 Trump appointees a chance to overturn Roe v. Wade. And I am a lawyer. I am paid to be pessimistic, but I think that's what the court is going to do. The best case scenario is that the court merely hollows out Roe v. Wade from within and makes it kind of a dead letter. Maybe they don't formally overturn it, but they drastically change what the legal assessment and evaluation of restrictions and bans of abortion look like. And I think it's much more likely that they're going to formally overturn Roe v. Wade. So that is going to kick abortion into state-by-state decisions. A number of states have trigger laws or older statutes still on the books that mean they will immediately ban abortion. So the national landscape is going to change very quickly. In addition, we have seen stronger and more creative bans on abortion. So the one that everyone is probably most familiar with, although other states are beginning to copy it, is the Texas ban, which makes prohibiting abortion a private cause of action that's enforced almost vigilante style by individual private citizens suing people who aid and abet securing an abortion. And thus far, courts have been unwilling to say that this is unconstitutional, even to hear the case, because they say, these are just private causes of action. We're not being asked to say kind of what the state can or can't do. Individual people get to enforce this. So that is frustrating, to say the least, and is also itself, even before the Supreme Court acts, having a big effect at the state level. So we're seeing a lot more restriction. I suspect that's going to increase dramatically, probably as of June is when I would bet that this case comes out from the Supreme Court, Dobbs. So it's going to continue to be frustrating news, and there's a lot of important work to be done in response to it.
So how do we're seeing increasing restrictions in the United States at a time when we've still been continuing to try to expand access internationally. So how do these two things interact? I'll let either of you jump in.
Well, I can say they interact at a policy and a normative level. It's an interesting interaction from my perspective, because some of the things that I'm talking about, like discussion of the right to privacy, that's a matter of American constitutional law. So that's something that lawyers talk about, and it's legal interpretation. But it interacts with the same policy choices and the same normative choices that underlie state level political action, potentially federal level statutory action, regulatory action, and international policies as well. So they're all kind of coming from the same root and operationalizing in different ways.
Yeah, and I'll maybe add, I think there is a stark contrast happening with a severe regression in the US at the same time as the global trend is really towards liberalizing access to abortion and reproductive health care. And it's fitting that we're sitting here on St. Patrick's Day. Ireland is one of many countries in the last, just 5 years that have really expanded access and recognized, I think, the foundational need for health, for safety, for well-being of delivering access to abortion as healthcare. So it is stark. I do think there is an opportunity, and I wish we weren't in this dark opportunity, but right, like a lot of countries have been there delivering care in tough and restrictive settings. And it's a little bit of an opportunity to humble ourselves and think about where we can learn from innovation that is happening in already tough and confined spaces, both on the service delivery side and the advocacy side. So I do hope that in this moment of crisis, we take the opportunity to learn from folks around the world who have been doing this tough work. I also think that, the history of domestic and foreign policy, we import and export like the same thing. So the Global Gag Rule has been out there for 40 years. Under Trump, they tried to impose a domestic version of it and did for a time. So, whatever we do within our borders, I think it's only a matter of time where we try then to export it. And even things that are starting in Texas and Idaho and Florida, I think we'll see opposition pick up and try to replicate it in other places around the world where they feel emboldened now to be on the side of the US and where we used to be, maybe at the vanguard and lead of reproductive rights. They will now try to mirror, the regressive laws that are passing and proliferating across the states and maybe validated by our courts.
So turning a little bit back to specifically the gag rule, we know that it's not in effect right now, but we know that it continues to have impacts even when it's not in effect overseas. Caitlin, can you tell us a little bit about some of the chilling effect and some of the lagging effects of the gag rule?
Yeah, that's absolutely right. I think most folks will know on the line, and certainly we found in our own research and conversations with partners around the world that, the gag rule is disrupting a range of health services when in place, including, of course, abortion information and services, but also access to contraception, to maternal health care, to HIV testing and prevention. It's also fracturing partnerships. So it's forcing orgs to choose a side. Are you going to comply with the policy and keep the funding, or are you going to maintain your right to deliver comprehensive care and information and give up desperately needed funds? And that's also doing what I just described, sort of emboldening opposition groups and policymakers to really erode a range of rights and to pass discriminatory policies. And unfortunately, this bucket of harm is not a set of things that sort of easily gets halted, gets reversed, gets solved for, even when an executive order like Biden signed a year ago goes into place, because we are talking about things of like shutting down a health center. Firsthand, right? It's eroding trust at a community level. These are not things that simply goes away. So while Biden's action was obviously the necessary first step, it did. And there's so much work both to rebuild the harm, but also just prevent this destructive back and forth, because, this cycle of harm, rebuild is what keeps us sort of at the status quo, which is unacceptable, and really prevents us from making that sustainable progress that we all want to see. And if it's helpful for like a more tangible, even example of it, I talked to colleagues who were impacted by the global gag rule, were cut off from funding and partnership from the US government under Trump. And what they describe is that even now that they're eligible for those kind of partnership opportunities, organizations are still reluctant to bring them into the fold, because programs are often 5-year-long programs, right? It takes time to like improve health at a community level. So it's good that they're 5 years long, except for that when you overlay that with the US election cycle, they're looking like, well, are we going to get a new president in 3 years? And are you going to be able to stick around to see through this project? So maybe it's not worth the risk. Like, you could be out halfway through and we need a partner who's going to be all the way there. So you see that long shadow the policy casts, and the looming threat of it being reinstated without permanent repeal really keeps some of the harmful impacts just firmly entrenched, and undermines the progress that we could make even in this window of when the policy's gone.
And you spoke about the cycle of damage and rebuilding. I mean, I think it's really important to note that the other side has been willing to push much, much further in terms of the damage that they're willing to inflict. I personally don't think that a future anti-family planning or anti-abortion president is going to be content with the boundaries of the Bush era gag rule. I think that the Trump administration set a new kind of high watermark, and that's going to be the minimum that we would see under a future administration. So we're seeing the sort of ripples of damage getting bigger, and that's that much more than that we've got to push back against on our side.
Yeah, totally agree. And I think you see echoes of that in Congress. There's anti-choice bills that would do just that. make the gag rule permanent and in fact expand it to unprecedented levels. So there are folks who are already thinking, those 2 steps ahead, building off what Trump did, which was devastating, and really taking it to new levels. So we gotta take our chance to end it once and for all before it goes to unprecedented harm like we've never seen.
And I think that's all sort of part of the same domestic and international pieces that we see our opponents being really bold. Like, these are really innovative, as Dara said. Like, they're really trying out new things. 10 years ago, a Texas-style abortion bounty law, I've never heard of such a thing. I can't imagine that anybody would have proposed such a thing. And now they're copying it in multiple states. So the sort of Overton window of acceptable discourse on that has gotten a lot wider.
Yeah, I've said to my students that the Texas law strikes me as like an overly clever law student trying to come up with like a funny hypothetical in class. But when you have judges, and Trump appointed over 1/4 of federal judges in the country right now, he was very effective at filling vacancies, and those are all life tenure appointments. So we are stuck with those judges for as long as they want to be judges. If they're willing to give it credence, I love that you reference the Overton window, because I really think that's what we're seeing. Is you're seeing a lot of kind of trial balloons of state level laws to see what people will accept. And I think we're seeing some like truly crazy bills that make everything else look slightly more reasonable. So I think the Missouri bill saying that treatment of ectopic pregnancies constitutes abortion and would be a felony. Ectopic pregnancies, which are not viable by definition and are life-threatening, and that gets some play. But then, like, the 6-week abortion bans, which would have been unthinkably restrictive, suddenly look more reasonable when you're like, well, at least it's not virtually requiring the death of pregnant people if they get an ectopic pregnancy.
And my own home state of Tennessee this week was in the news. There's a debate about a bill that would let a rapist's family member sue someone who had an abortion after having been raped. It wouldn't preclude that. So yeah, I think it's the spaghetti against the wall. Any crazy thing they can come up with, they're willing to toss it out there and see who bites. And we've got these judges who are all too willing to sort of, whistle past these insane laws. So turning to, well, let's talk a little bit first about the way forward. We're in this place and we've got to figure out how to get out of it. And so what do we need to be doing? Where should we be concentrating our energy? And what are the most effective places that we could be putting pressure on to both domestically and internationally to get out of this regressive place that we're in and to a place where we can start making some actual progress?
I can go first if you want. Okay. I mean, first, I just want to be real. It's hard to sugarcoat the moment that we're in. So I appreciate, Stacey, the question of like, we got to go forward. But I think, we also got to let ourselves like sit in the rage a little bit of the moment. And like, I think for those of us working on these issues at the federal level, like this month, passing a funding bill with zero progress forward for reproductive health, both in the US and around the world, was just profoundly disappointing and such a failure to meet the moment that we're in. On the global side, no increased funding for international family planning, no increased funding for UNFPA, and no permanent gag repeal. So like, I just want to name that it is a massive disappointment and, fails to meet the moment. And it's a squandered opportunity. Like, I know we've all been out here telling you, like, this is the year to get that done. And it was right. Like, we have never had a stronger movement for permanent gag repeal. Our funding investments have been stagnant for over a decade. And our world has changed so dramatically, between COVID, between conflict, between humanitarian crises. all of which have magnified the just deep disparities in access and outcomes that already exist for so many communities around the world. So, but setting aside that, the rage and the hurt doesn't go away, but that doesn't change the reality that like, this is still what the world needs. And so I think it's so important that we continue to be out there fighting for these resources and policy change. And I'm so grateful that you are. So I guess when I think about the sort of 3 buckets that I'd put the work into, one is like so foundational that the education work is still really needed. I do think that there is still some complacency from Congress that like, we got rid of Trump, we have a pro-reproductive health administration, and that's gonna save us. And like, clearly it's not enough. So I think we need that education to say like, why is the gag still causing harm, even though it was rescinded a year ago? We need help, I think, telling that story. We also need the motivation, and just like we might be feeling tired and worn, I do think, our policymaker champions and definitely the staff who are like underpaid and overworked need the thank yous for those that have been out there slogging away and fighting. So don't underestimate the power. I know you guys will be hitting your virtual visits on Monday of like, the thank yous can mean a lot and can really go a long way to keep people in this fight. And then of course there's accountability, and sadly there's probably more folks who need a little bit of accountability than folks that need thank you. So we need to like shift more people into the thank you camp. But there's a lot of people who could be doing a heck of a lot more. And it's so important that they hear from constituents, I think, that you guys are watching how they show up and deliver on these issues, and that status quo is not enough. So I guess it's clear to me that we need to build more power so that we're ready to seize whatever the next moment presents itself. And I guess I'll offer a note of like, as we're in this chaotic time, especially given all that Dara laid out, I think we're about to hit a moment of crisis in the US. We already sort of right there, but I do think that June Supreme Court decision moment, it's hard to predict how it will galvanize the movement in the US. And I think part of our work will be also to make sure that what comes out of that, like the demands for fundamental reshift in power and how our bodies, our lives, our rights are conceptualized by our policymakers, will be to make sure that our vision is broad enough that it includes global, that it does not, sort of revert to dealing with the crisis within our borders only, that we hold the whole and say like, our vision is big for the world, for foreign policy, includes push on gag and all the reproductive health needs that we say around the world, because we don't know how that's going to shake up what's possible in the future in a moment of crisis. So, I think that's part of the work too, just to be ready for that moment and to be a vocal voice for that broader vision, because we can't, pick and choose. Our destinies, I think, are tied up in each other.
Yeah, I think there's a smorgasbord of places that we can all be working. So in some sense, it's kind of picking where your interests are and where you think you can be effective. From my point of view, I kind of think of 4 areas. So one is public, get angry and get loud about the issue of abortion, about reproductive health care. When the Supreme Court decision comes out, I hope that people are very loudly and angry about it, because public opinion is with us. And I am frustrated by how, we are not, in sort of the national media, we as a society are not characterizing the other side as extremist, when that's what they are compared to what most people think about abortion. So I hope that it becomes very clear that this is drastically out of step with how we think about reproductive rights generally. Second, because I'm a lawyer and a law professor, I do want to keep talking about the judiciary, both to encourage Biden to keep up the pace of filling court vacancies, but also to raise the issue of the legitimacy of the Supreme Court, that it is now dominated by really strong right-wing judges who are enacting policy preferences and who were put there, through very explicitly political machinations. And I think that we should be continuing discussions about changing the number of seats that are on the Supreme Court. It's not something that has been a really viable political issue, but I think it should at least be under discussion and saying, we understand that this is just enacting policy preferences. Third, the key for any kind of federal action is filibuster reform, which ties into a lot of other issues. There are all kinds of policy issues that the majority of Americans support that a minority of elected representatives in the Senate are able to stop. And so that puts us, in excellent company across a whole host of issues. But I think we should be contributing to that discussion. And although I definitely agree that we need to keep a broad focus and see ourselves as, thinking of these rights and thinking of people internationally and not just turning inwards, we do need to be active at the state level, because I think that's where we're suddenly going to see a lot of this regulation happen or not happen. It could be guaranteeing rights. Washington State just passed a law to block a Texas style law in the future, saying that you cannot institute these kind of vigilante enforcement statutes. So if Roe v. Wade is overturned, that makes abortion a political issue. We should talk about it at the federal level, but a lot of it's going to happen in the states. So know your state representative's phone number as well as federal.
I do really think it's important to take a moment to acknowledge, and this is another way that the United States already does, and if Roe v. Wade is overturned, will come to even more closely parallel what we see overseas, in that these kinds of denial of services and these sorts of restrictions impact low-income populations. We're talking about low-income countries generally overseas. And just because of demographics, we're talking about impacting Black and brown people more heavily. Wealthy people are always going to be able to travel and obtain abortions when they need them. It is people who are least able to adapt to those circumstances to sort of buy their way out of these restrictions that are really going to be the ones to suffer. And I think that any discussion of this topic, if we don't make a point of highlighting that, it could get lost. So let's turn over to the chat here and see if we've got a couple of questions. So is there any country in particular that would serve as the model for American grassroots resistance to anti-abortion laws and movements?
I think I love the question, a lot of good models to look at. So there's probably not one right answer here. I know I've been hugely inspired of late of the green wave that's happening across Latin America. And in fact, just this week in Guatemala, there was a hugely regressive law that attacked both reproductive health. It massively increased the criminal penalties for abortion, but it also sought to criminalize and define families very narrowly as only a two-parent heterosexual couple, ban sex ed in schools. Like, you pick the thing, they tried to do it. It passed through Congress. It was being sent to the president, who is a very conservative president. And there was this massive domestic to Guatemala and also international outcry about the law that honestly, I think caught them on their heels a bit. And the president ended up kind of like walking it back a little and was like, I think this might be in violation of a few international treaties that we've signed on to, and encouraged Congress to revisit it. And they ended up shelving the law. So it is dead for now. And I think it is a powerful example of like an immediate, in the streets, vocal, visible, but also internationally coordinated groundswell of rejection. And in a solidarity movement of repro working with LGBTI rights too, that provides a powerful model to look at. And certainly, there are many others in, all corners of the globe, but that's one that's top of mind for me because it was an amazing show of strength and success out of Guatemala just this week.
what about, let's say the Supreme Court does what we think they're going to do and Roe is overturned. What impact do you think that would have internationally? Do you think that it would embolden the countries that already kind of tend towards a restrictionist view? Do you think it would dampen the liberalization movements that are happening in some other places? What do you foresee that impact as being?
Well, I can certainly say from a legal point of view, we export our legal understandings, and we have exported a lot of principles from American constitutional law to countries that have written or amended their constitutions since we wrote ours. And legal activists in the United States are active in other areas, in other countries, sort of exporting the arguments that they've made. So absolutely, I believe that we're going to see copycat legislation or attempts at legislation in other countries. It's a global conversation, and so even though the specific doctrine of Roe v. Wade obviously is limited to our borders, the legal techniques and principles and strategy behind it is not.
Yeah, and I'll maybe add on the more personal level, I think the type of violence and harassment that we've seen for healthcare providers in the US used to be an ugly example of American exceptionalism. Like, it really wasn't something that happened in a lot of other places around the world. But I was just with the head of the International Planned Parenthood Federation last week, and he was talking about in the last couple of years, they've really had to up their investments in security, in support for their frontline abortion providers around the world, because you are seeing this replication of tactics. So it's not just the laws, the policies that are getting replicated and exported, but the really ugly personal violence, harassment, and tactics that we also see for our healthcare providers in the US. So I think that they will get further emboldened, and there'll be more of that as they have more success here.
Absolutely. I think that's a good point. So one more question from the chat. What do you see the role of abortion funds being after the presumed demise of Roe v. Wade? What role could they play?
Well, it means we're going to have a patchwork of regulation. So there is abortion funds at least attempt to begin to remedy some of the classist and other intersectional issues of access to reproductive health care. So they are meant to provide assistance to people who don't have the private means to travel to where they could get care, but they're very obviously imperfect. It's people, doing their absolute best to overcome an incredibly, unfair structural disadvantage. In addition, along with the trend of overly clever legal regulations, you've got states trying to prevent that. So there are bills being considered that would say not only is it illegal to get an abortion within our state borders, it is also illegal to cross state lines to obtain an abortion. And again, we will see how courts treat these attempts. It's pretty appalling and goes against many principles of constitutional law, but that has not stopped courts up to this point. So it's one technique that I think we will see, but opponents to abortion are trying to shut that down as well.
So I think we were going to see if anybody had a question they wanted to ask. I'm not able to see everybody's screen, so ask Yasmin or Grace if they're watching that.
Yeah, if folks are interested in asking a question directly to our panel, you can either drop it in the chat and we'll invite you to come off mute. Or if you are on your computer, you can go to the reactions button at the bottom of your Zoom screen There will be a little raise hand icon, as I have just done. I'll just hand over my face. And then we will call on you.
I didn't see a question, but somebody did mention, and I think it's interesting to talk about this sort of way that we're really starting to publicly see right-wing movements bleeding together. Sort of nationalist movements and anti-reproductive rights movements. Like those have always been linked, but I think we're starting to see those linkages being more overt and more public and more overlap. And so, how do we fight that fight on kind of multiple facets? How do we continue to highlight those linkages and call those people out when they're sort of carrying each other's water?
I like yelling about them on the internet because that's how I spend my free time. But that's absolutely right. Something that really illustrates this is the guy who drafted the Texas abortion ban is not directly involved in the Dobbs litigation since it's coming out of Mississippi. But he did submit an amicus brief, meaning, you know, you're not a party to the lawsuit, but you have some kind of interest, so you can submit a brief to the Supreme Court to help argue one side or the other. So he submitted one of these on behalf of Texas Right to Life. And in that brief, he says, not only court should you overturn Roe v. Wade, but you should also overturn the whole line of illegitimate court decisions. Number one, going all the way back to Griswold v. Connecticut, which is the very first case that said that the right to privacy encompasses right to birth control at all. So he wants to open the door to states being able to outlaw contraceptives of all kinds, but also says, court, you should also take this opportunity to overturn Obergefell v. Hodges, which held that the constitutional fundamental right to marry is something that is held no matter the gender of your proposed spouse. So he's saying, while you're in there, while you've got the hood of the Constitution up, you should yank marriage equality out of there as well. So we're absolutely seeing a huge link. And I think it helps to point out that this is just a campaign to take us back decades and possibly further than we ever have been before, decades back.
So a question in the chat from Hannah, and this is a question that I've asked myself every day that I've been working in this field, is that the data is very clear on the impact of abortion restrictions on the actual number of abortions that happen. And that, you know, when you restrict access to birth control, you get increased rates of unintended pregnancy and more abortions. So obviously, it seems logical that if conservatives really wanted to reduce the incidence of abortion, they would set about reducing the incidence of unintended pregnancy. And yet, nothing seems to convince them to do that. So I don't have an answer for that question. I'd love to know if the two of you do.
I don't know if I have an answer, but I do think it is clear, and it reveals, and this latest government funding bill reminded me that, like, they are not just coming for abortion access. I think Dara is totally right. Like, they are coming for birth control. They are coming for our all personal decision making about who you love, what you do with your body. You know, it's abortion is the canary in the mine, but like the agenda, the iceberg beneath, choose your analogy, like it is much bigger. So I think, you know, you're right. Like if it was truly just we want to reduce abortion, the data is clear. So I think their agenda is much bigger and deeper than that, and is about controlling so many facets of people's lives and decision making. So, you know, there's only so much utility in like arguing with them on the facts and data, because I just think like their end goal is different, and they've lied about that for a long time.
And I'll just add an even more cynical note to say that people who are actually affected by this, you know, people who would be affected by policies like by, you know, supporting comprehensive sex education and access to contraceptives and all the things that we know would decrease abortion rates, don't donate money to them. vested political interests and corporations do. And so we have to make it clear to the extent we can that we're not going to support groups and corporations that fund that kind of action. And it can be very hard to do, but if people get angry enough, businesses start to listen. You saw this a little bit, although they're still very far from where they should be. But Disney, with the Don't Say Gay law in Florida, initially was trying not to speak on it, and people yelled at them until it became clear, no, we're mad that you're contributing to the politicians who are supporting this. And that's the kind of conversation we need to be having about reproductive health care as well.
So Grace had a question. Are we seeing similar anti-abortion and far-right nationalist alliances in other countries? Is that a similar trend, or are we special?
I think, unfortunately, we are not special in this regard. I think there's a lot of convergence of authoritarianism and crackdown on rights, including abortion and reproductive rights in other countries. You often see that trend. And in general, you know, authoritarians shrink space for civil society, and that spills over to reproductive rights and any number of human rights issues that I think are at play. But I don't think that's a new move. And in fact, it's a hallmark, I think, of authoritarianism, that you're going to restrict rights, which have empowered your populace to live their lives freely and well. So I don't think that is a unique American phenomenon, but a deeply disturbing one that obviously, like, we need to keep our eyes on the bigger ball on. So thanks for the question.
And I have a question from Drew asking about how we get voters to understand that reproductive rights are an economic issue in addition to being a personal medical issue.
Yeah, this is a really frustrating, everything I'm talking about is frustrating for me, but this is particularly frustrating because, number one, you see this discussed really explicitly in the legal analysis. One of the reasons not to overturn a prior case is that people rely on that case. And in the past, justices such as Ruth Bader Ginsburg pointed out that people, and especially women, have come to rely on access to abortion as a way of ordering their lives and you know, deciding what they want their families to look like, what they want their working lives to look like. This is something that is knit into moves towards gender equality. And the conservative justices, who I believe are going to overturn Roe v. Wade, scoff at that and say, no one makes decisions about what job to take. No one is able to support themselves because they rely on Roe v. Wade. And that's simply not true. And we also see that in the incredibly frustrating discussions and collapse of an attempt to do things like give paid family leave. We do not, as a society, we do not as politicians, as a legal community, accept that family caregiving is a necessary function, is a necessary job that contributes to our economy and contributes to people as productive members of society, however they want to define productive, but in a way that benefits us all. And so I do think, at least to my mind, it's effective to try to tie those together and say it's the same, you know, the choices about when to have children, whether to have children, what your working life, if you are working, looks like. These are all of these issues are linked, and we know that it affects people. We know that it affects families' individual decisions about who's working. We know that it drives people out of the workforce. And we have to talk about that really explicitly and say this is not about someone deciding whether or not to engage in sexual intercourse and Googling is Roe v. Wade still good law before they do so. This is a fundamental part of how we organize our lives and organize our families.
So I see a question from Hannah saying that it seems promising that the city corporation offered to pay for its employees to seek abortion care out of state if that becomes necessary. Is that the kind of trend that we could push forward? Can we use that corporate influence, that social media influence? Is that something that we could harness?
I think the corporate pressure side is a really effective one, because it demonstrates this ties into what I was just talking about. People make decisions based on, these kinds of issues, and companies that provide this kind of support are going to get better and happier employees, who do a better job, and who make that company more profitable, as much as, it kind of sucks to reduce this to capitalism. But this is an economic choice that makes sense for companies. And I think that we as consumers need to make that clear. We as employees need to make that clear. And to the extent that you have power as an employer, make it clear. Social media is a whole other kettle of fish, in the sense that, I think we've seen a lot of damage that social media can do. And those social media companies are still, I think, imperfectly wrestling with how to fix it. And their kind of questions of profit, I think, are sort of muddling what I would like to see them do.
So we're just a couple of minutes off coming up on the scheduled hour. So I wanted to say thank you to both of you for being here with us tonight, and give you an opportunity to, is there anything else that you want to add that we didn't talk about, or any kind of final thoughts you want to leave us with?
I would just say thank you for being here, and every time you contribute your voice makes an impact. It's important that people hear that we're mad about this kind of stuff. So thank you for adding your voices to the chorus, and I hope that you continue to do so.
Yeah, I'll just echo that. And I think especially in this virtual world, it's hard to get the energy from each other in the same way. But I think it's so great to see your faces, to see your chats, and to know that we are part of this global movement of people fighting in every corner of the earth to make progress. So just grateful for your energy and your voice, that you chose to spend your time this way.
So thank you both so much for being here with us tonight. I think this was a wonderful discussion. We really, really appreciate your time and your expertise.